Imagine not being able to read the paper because your hands were shaking. Imagine not being able to read newsprint as your world faded to black. The National Federation of the Blind, Newsline, Indiana. With your host, Lee Martin, and co-host, Florence Myers-McSwine.
We want to welcome you to this week's show with the National Federation of the Blind, Indiana. And as you indicate at the start of our show, what if you just suddenly lost your sight and you had no vision at all? Where would you go? What would you do? We hope that you learn a lot from our NFB Newsline shows so that we can give you a lot of awareness and so that you can cope and you can learn that there is life after blindness. The National Federation of Blind has a service with NFB Newsline that provides you with over 500 newspapers and publications. Now you can read your national newspaper, your state newspapers, and magazines. And there's a myriad of devices that you can also use. And we have Florence, the host, and she will tell you a little bit more about some of the devices and some of the magazines.
Okay, I certainly can, Lee. Now, some of the devices we use for NFB Newsline is, of course, our iPhone, which I love using the app, the landline phone, our digital player from the Talking Book and Braille Library. We also use the computers as well as what some would call the A-Lady, which is Amazon Alexa. And so these are some tools that we use to access this free audio information service. And I particularly love reading the newspapers as well as the magazines. Now, some of the magazines that I use is Aarp Magazine. I love reading that. It's got a great information for seniors like me. There's also Diabetic Living. It's got a lot of great information for people who are coping with diabetes. There's Diabetic Forecast magazine. There's also WebMD, which gives a load of information about your body, what's going on with your body, and a lot of resources and information about your body, as well as Shape magazine for people who are health fanatics somewhat. And NFB Newsline is a great tool to have. And we have a special guest today, Dr. Emily Hobley, who is an assistant clinical professor at Indianapolis Eye Care Center. And she's got some great information for you about eye health and eye care. So stay tuned.
If you or someone you know is visually impaired or print challenged, the National Federation of the Blind has a resource you need.
Wow, I scored a touchdown when I found sports on NFB Newsline.
I enjoy reading TV guide listings on NFB Newsline.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
We are the nation's blind. We read NFB Newsline.
It's free.
I am a blind vendor, and one of the things that I truly miss is reading Vending Times magazine.
Hoosiers can hear Indiana magazines, circulars, national magazines, and information from across the globe. Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
It is a fantastic service.
Subscribe free to NFB Newsline today.
Welcome back to this segment of the National Federation of the Blind, Newsline, Indiana. And we're honored today to have a special guest, Dr. Emily Hobley, who is Assistant Clinical Professor at Indianapolis Eye Care Center. And Dr. Hobley, welcome to our show.
Hello, thank you.
Yes, Dr. Hobley. Welcome to the show.
Thank you for having me on. I'm very excited to be here.
So we want to know, being as though we're doing this by Zoom, and it's kind of different, but several things we want to know about your profession, So could you tell us a little bit about your profession and what it entails?
Yeah, so I'm an optometrist. I work for the Indianapolis Eye Care Center, which is located downtown on the IUPUI campus. I work with primarily low vision patients and patients who have had traumatic brain injuries or strokes to help rehabilitate them to return to activities of daily living. They oftentimes will have changes to their vision from these changes to the brain or changes to their eyes, and I help to get them back to a state where they could continue doing the things that they want to do or love to do. So that's sort of what I do on a day-to-day basis. Optometry in general is just a regular eye care provider. We do full eye exams, check your prescription, we do contact lenses, all the glasses and everything. We check the health of the eyes. We can treat glaucoma. We can treat quite a number of things. If you've got a red eye or things like that, we do a lot of that. We don't do surgery, so that would be ophthalmology. However, we can do pretty much everything up to that point.
Okay, now Dr. Hobley, now also I noticed that you also work with the low vision. Can you tell us a little bit about that?
Yeah, so low vision is a part of optometry and ophthalmology that helps care for people who have vision changes, most often due to retinal disease or corneal disease. And these changes lead a patient to be oftentimes legally blind or visually impaired. Now, that doesn't mean that they're completely blind. Oftentimes, patients have significantly reduced vision, but they meet the state standard for legal blindness. So that means 2200 vision or worse with their full correction. And so these patients are significantly visually impaired. However, they still have a small amount of vision. And I help those patients with magnification options to help make the image much larger so that they can see what they're looking at. As well as we do things like filters to help control lighting. We can do distance telescopes. Oftentimes we can even help patients return to driving despite their visual impairment with a special bioptic telescope and a bioptic certification. They have to do some training, but we can get them back to driving, which is oftentimes, a patient's independence to them. So we work with a lot of different organizations within Indianapolis and around the state of Indiana to help get patients back to what they love to do. There's a lot of different resources available to do so within just the area, and you guys have probably talked about them quite a bit, but we work very closely with organizations like vocational rehabilitation, which helps get individuals to work or school through different vocational trainings and adaptive technologies such as computer use or different devices. And then we work very closely with BOSMA, which is the organization that helps the visually impaired train individuals to maneuver their space safely, cook, clean, all of those different things. They also teach computer training despite their visual impairment.
Yes, and those entities there, we work pretty closely with those as well. Yeah. And, we also like to, since we're going to do that, we give a shout out to Crossroads as well.
Of course.
Crossroads Rehabilitation. They do a fantastic job over there as well. And then we also have the statewide independent living centers throughout the state of Indiana for those individuals that may be interested. That those you can find that information. Just go to Indiana Statewide Vocational Rehabilitation Services, and also you can go to our NFB Newsline page on NFB Newsline. You can go, that's nfbnewsline-in.org, and you can find out more information about those particular resources as well.
Great.
Okay, now Dr. Hobley, How long have you been a clinical professor at Indianapolis Eye Care Center?
So I've been a professor for about 2.5 years. I started at Indiana University's optometry school's clinic in Indianapolis about 2.5 years ago. And that means I basically work with students in our clinic to teach our 4th-year students who are doing their clinical rotations about eye care and specifically low vision services and vision rehabilitation. And so I work with students in the clinic. We go over different cases. We work with patients together. They get to see the patients themselves, and I help them through the process so that they understand, the implications of what they do, but also, to help them figure out each case individually so that they're not just sort of putting one case on everybody. So they understand the differences of each person and get to care for them individually, which is great. And so I work very closely with the Indiana University's optometry school. I'm on their faculty as an assistant clinical professor. It just means that I'm a little bit newer to the professor world than some of my colleagues who are full professors or associate professors. I did work in private practice for about a year before joining the faculty, and it was the best decision I've made. I love working with students, and I love getting to see the little light bulb go off in their eyes. So it's great.
Dr. Hobley, when were you, what made you decide to get into the optometry field?
That's a really good question. It was actually my father. He had retinitis pigmentosa as well. And so with that condition, I learned early on the challenges of the visually impaired. And he couldn't drive from the age of 30 on. He had a lot of troubles sort of maneuvering around his space, and it took a long time for him to learn to adapt to the vision loss. And sort of that spurred my interest definitely in eye care. I had to go to the eye doctor a lot as a child myself. I've had glasses and contacts since I was 5 years old. And so I have really appreciated the eye care professionals that have helped me along the way and helped my father. And so it only seemed logical to go into a field that I had seen previous experience of helping individuals and doing so in a very real and personal way. Our local optometrist at home in my hometown was very personable. She was not just she didn't see us as another set of eyeballs. We were full people to her, which is really encouraging to see. And I wanted to do that as well. And so through my undergraduate career at Loyola University Chicago, my graduate career through New England College of Optometry in Boston, and my residency through SUNY at the Veterans Affairs Hospital, I continued to pursue that actual low vision aspect simply because I wanted to be able to help people like my father, who had the same condition that a lot of my patients have.
It's very encouraging to know that there's professionals such as yourself that really are endeared to their clients, their patients, such as myself and such as Florence and such as a lot of our colleagues out there. I know that through some of my experiences, and for you to talk about the working with the veterans, as a veteran myself, I want to thank you as well for assisting us veterans in that field as well. Loyola sits right next to Hines Rehabilitation Center, where I've done my rehabilitation as a veteran. And I just want to thank you once again for all the work that you do with the veterans, because it is very valuable for veterans like myself. We really do appreciate that. So we're going to take a short pause, and we're going to come back with our guest, and we will see you shortly.
I
I'm Danny Wayne Beamer, Program Manager of the Elder Blind Program at the Will Center in Terre Haute, Indiana. I introduce the NFB Newsline to seniors in 13 southwestern counties in Indiana. I also utilize the NFB Newsline for my radio station public affairs shows. The NFB Newsline. Experience it today.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
We are the nation's blind, and we read NFB Newsline.
If you or someone you know is visually impaired or print challenged, the National Federation of the Blind has a resource you need.
I use NFB Newsline when reading Hammond Northwest Times.
Using NFB Newsline, I read the Christian Science magazine.
Dad, you read Jerusalem Post too.
Learn more by calling 855-963-6476 or visit nfbnewsline-in.org.
Live the life you want. Read NFB Newsline.
It's free.
Welcome back to our show with Dr. Emily Hobley. And Dr. Hobley, now, what are some of the health conditions that contribute to blindness or vision loss, and how can they be prevented?
Yeah, so there's a lot of common systemic conditions that cause changes to the eyes. One of the biggest would be diabetic retinopathy and diabetes. Diabetes is a condition most people know about where blood sugar in the body gets too high and it causes damage to different parts of the small blood vessels in our body, and then it can spread to start damaging organs and things like that. Well, if you have diabetes in the rest of your body, oftentimes you'll have it within the eyes. And so sometimes patients will actually be diagnosed with diabetes simply from their eye exam because we see those changes pretty early on in the condition. With diabetes, those blood vessels have a tendency to leak fluid. And when we see that in the back of the eye, we can get an idea of how bad their blood sugar levels have been or how well they're controlled. Diabetes not only causes changes to the small blood vessels in the eyes, but it also causes changes to the small blood vessels in the feet and in the kidneys and pretty much anywhere else in the body. And so the eye is actually the only place that you can see those changes without having to cut you open. But ways to prevent that would be a good healthy diet, lots of good exercise, keep moving, making sure that you're trying to avoid really sugary foods or high amounts of carbohydrates. So you want to keep your diet nice and varied, lots of green leafy vegetables, meat, cheese, all that stuff, but not so much all the carbs. Which is a high in sugars that increase the blood sugar level, which increases the diabetic changes. Another condition that's fairly common within the eyes is glaucoma. And that's not really related to any other systemic diseases, but glaucoma is a silent condition. You don't see those changes really until those changes occur to your eyes in a very drastic way. So glaucoma is a condition where the nerve of the eye in the back, which is shaped kind of like a donut with a hole in the middle, that's the nerve is normally that shape. But if the hole in the middle gets bigger over time, that's what we call glaucoma. And that can be caused by high pressure in the eyes. Oftentimes patients don't know that it's happening. And so that's why a regular eye exam is important, because glaucoma can cause significant damage to our vision. We can start losing our side vision and basically end up with tunnel vision. So it's like a very small area that you're seeing through with sort of the end stages of glaucoma, and it can cause permanent blindness, and we don't want that. Oftentimes patients don't know that it's happening, and so regular eye exams are important because we check the pressure and we check the back health of the eye to make sure things are not progressing. Another really common condition that causes changes to the backs of the eyes, especially in patients who are a little bit older, is macular degeneration. Macular degeneration is a condition whereby the retina has little deposits that sit within the retina in the very center of our vision. As those deposits sit there, they end up causing damage to the retina over a long period of time. Sometimes that damage can cause scarring, or sometimes that damage can cause fluid from underneath to leak up. So if you have just straight damage, that's what they call dry macular degeneration. If it causes fluid or blood to leak up from lower layers, that's what we call wet macular degeneration. Ways to help prevent or slow the progression of macular degeneration is a very good diet that has things like lutein or zeaxanthine, which are often found in tomatoes and spinach, really good, healthy foods. For vascular health as well, so that's high blood pressure, high cholesterol, diabetes, things like that have also been linked to macular degeneration. Also known as AMD, it is also changed with sun exposure. And so if you're outside a lot and looking out in the sun and you're not wearing sunglasses, that can increase the progression of it. So making sure you have a good, healthy diet, exercise, all those good things, a good varied diet as well that has zeaxanthine and lutein, as well as making sure you wear sun protection outside. Sometimes those things can happen regardless because of genetic predisposition, unfortunately. However, we want to try and slow it down as much as possible. Another really common thing that happens to individuals are cataracts. Pretty much everybody will get cataracts if you live long enough. It's one of those perks of birthdays. However, with cataracts, they can be increased. You can get them much younger in age with things like diabetes, a lot of sun exposure. If you don't wear sun protection or light protection with different tasks like welding, things like that, you can increase the rate with which you get cataracts. And so cataracts are pretty well corrected with cataract surgery, but you do have to be healthy enough for surgery.
Okay.
So most people will get cataracts probably in their 60s, but it could happen sooner if you have these other conditions.
Well, that's quite a bit of information there. It's very good. I'd like to inform our viewers and listeners that you can go to NFB Newsline and go to our Diabetic Living magazine and our Diabetes Forum and learn more about what Dr. Hobley has just spoke on. So, Doctor, I know oftentimes when people come in with severe eye conditions and they're on the verge of losing their sight, are there any methods out there right now that can help a person maybe regain their sight at some point in time?
Yes, there are. So with diabetes and with macular degeneration, oftentimes there are changes within the retina that can be reversed. There are medications they can inject into the eye that help resolve some of that fluid if it is causing vision changes that are significant. That would be with an ophthalmologist. Also, there are procedures that can be performed with basically a laser to help reduce the fluid release within the blood vessels so that they don't damage the retina as much. With glaucoma, for instance, unfortunately, they can't return the vision, but they can help prevent it from progressing with eye drops or surgical methods to help reduce the pressure within the eye so that you don't have any further damage. Unfortunately, sometimes, even with those methods, vision still doesn't return, unfortunately. And that's sort of where I come in is when patients do lose their vision, they still have some vision left, and I can help them magnify the image with different tools and devices to help them still be able to see the size print that they want or do the activities that they used to be able to do.
Now, in those cases, that would be people with what they would call with light perception. The people that still have some light perception, would they be considered legally blind at that point, or would they, with the doctor's office, would you consider them to be blind?
Yeah, so that's a good question. Light perception is sort of the very end of our ability to have any vision. Legal blindness or visual impairment actually starts much earlier on. Legal blindness actually is only 2,200 with full correction. And so that means that a patient can see what a person could see at 200 feet, they have to be at 20 feet to see it. So they have to be much closer in order to see that. Versus side vision loss can also be considered a part of legal blindness. You have to have about 10 to 20 degrees of peripheral vision, which is a very, very small area, to be considered legally blind. That spectrum continues up through many different categories of visual impairment. You can have hand motion where you only see movement. And then after that, there's light perception, which is the sort of the extent of any vision that people will have, where they can only detect if a light is on or off. And then after that, that's complete blindness, where they can't detect even light.
Well, that's a lot of good information, and I've been there. And we're going to take a break and come back and talk more about this. That was great information that you're giving us, Dr. Hobley, and we'll be right back after the commercial.
The National Federation of the Blind knows that blindness is not the characteristic that defines you or your future. Every day we raise the expectations of blind people because low expectations create obstacles between blind people and our dreams. You can live the life you want. Blindness is not what holds you back.
We want to welcome you back to the final segment of this show, and we'll have a continuation speaking with Dr. Emily Hobley next week. So we've covered quite a bit of information, and there's so much more that we want to cover with Dr. Hobley. And Dr. Hobley, we want to thank you for coming on to our show for this week, and we look forward to having you back next week as we talk about some of the psychological aspects of when a person finally loses their sight, and what you have to do to give them strength enough to get up out their chair and move forward in life, because that is a very devastating part of our lives when we do lose our sight. And I've been there, and so many other people have been as well. So we want to thank you once again, Dr. Hobley, for today's segment, and we look forward to next week's segment with you.
Thanks so much. It's been my pleasure.
Okay, so join us next week as we continue our conversation with Dr. Emily Hobley, and take good care of yourselves, and God bless.
The National Federation of the Blind, Newsline, Indiana. For more information, go to nfb-in.org or call 855-963-6476. That's 855-963-6476. The National Federation of the Blind encourages you to live the life you want.